Given the classification of anemia, explain in detail about the iron deficiency anemia. First, what is anemia? Anemia may be defined as any condition resulting from a significant decrease in the total body erythrocyte mass. Measurement of total body RBC mass requires special radio labeling techniques that are not amenable to general medical diagnostic work. Measurements typically substituted for RBC mass determination takes advantage of the body's tendency to maintain normal total blood volume by dilution of the depleted RBC component with plasma. This adjustment results in decrease of the total blood hemoglobin concentration, the RBC count and the hematocrit. Therefore, a pragmatic definition of anemia is a state which exists when the hemoglobin is less than 12 grams per deciliter or the hematocrit is less than 37. Anemia may exist as a laboratory finding in a subjectively healthy individual because the body can within limits compensate for the decreased red cell. Coming to the classifications of anemia. Anemias can be classified by cytometry schemes, that depend on cell size and hemoglobin content parameters such as MCV and MCHC, and also on erythrokinetic schemes, means that those take into account the rates of production and the destruction. Biochemical or molecular schemes, those that consider the etiology of the anemia at the molecular level. Example, sickle cell anemia. Anemia can be classified by cytometry schemes or erythrokinetic schemes or biochemical or molecular schemes. Cytometry classification. Because cytometry parameters are more easily and less expensively measured than are erythrokinetic and biochemical ones, it is most practical to work from the cytometry classification to the erythrokinetic and then hopefully to the biochemical. Your first job in working up with a patient with anemia is to place the case in one of the major cytometric categories: normochromic normocytic anemias, hypochromic microcytic anemias, and normochromic macrocytic anemias. Normochromic normocytic anemias. In these, MCHC and MCV will be normal. These include anemia of chronic disease, hemolytic anemias that are characterized by the accelerated destruction of RBCs, anemia of acute hemorrhage, aplastic anemias, which are characterized by disappearance of RBC precursors from the marrow, microcytic hypochromic anemias, that is with a low MCHC and low MCV. These include iron deficiency anemia, thalassemias, anemia of chronic disease, normochromic macrocytic anemias, that is normal MCHC and high MCV. These include vitamin B12 deficiency, folic acid deficiency. Anemia occurs when you have a decreased level of hemoglobin in your red blood cells, and hemoglobin is the protein in your RBCs that is responsible for carrying oxygen to your tissues. Iron deficiency anemia is the most common type of anemia, and it occurs when your body does not have enough of the mineral iron. Your body needs iron to make hemoglobin. When there is not enough iron in your bloodstream, the rest of your body can't get the amount of oxygen it needs. While the condition may be common, many people don't know they have iron deficiency anemia. It's possible to experience the symptoms for years without ever knowing the cause. In women of childbearing age, the most common cause of iron deficiency anemia is a loss of iron in the blood due to heavy menstruation pregnancy. A poor diet or certain intestinal diseases that affect how the body absorbs iron can also cause iron deficiency anemia. Symptoms of iron deficiency anemias. The symptoms of the iron deficiency anemia can be mild at first and you may not even notice them. According to the American Society of Hematology, most people don't realize they have mild anemia until they have a routine blood test. The symptoms of moderate to severe iron deficiency anemia includes general fatigue, weakness, pale skin, shortness of breath, dizziness. There will be strange cravings to eat items that aren't food, such as dirt, ice or clay, and there will be a tingling or crawling like feeling in the legs, tongue swelling or soreness, cold hands and feet, fast or irregular heartbeat, brittle nails, and frequent headaches. Causes of the iron deficiency anemia. According to the American Society of Hematology, iron deficiency is the most common cause of anemia. There are many reasons why a person might become deficient in iron. These include inadequate iron take, pregnancy or blood loss due to menstruation, internal bleeding, inadequate iron take. Eating too little iron over an extended amount of time can cause a shortage in your body. Foods such as meat, eggs, and some green leafy vegetables are high in iron. Because iron is essential during times of rapid growth and development, pregnant women and young children may need even more iron rich foods in their diet. Pregnancy or blood loss due to menstruation. Heavy menstrual bleeding and blood loss during childbirth are the most common causes of iron deficiency anemia in women of childbearing age. Internal bleeding. Certain medical conditions can cause internal bleeding, which can lead to iron deficiency anemia. Examples include an ulcer in your stomach, polyps in the colon or intestines, or a colonic cancer. Regular use of pain relievers such as aspirin can also cause bleeding in the stomach. Inability to absorb the iron. Certain disorders or surgeries that affect the intestines can also interfere with how your body absorbs iron. Even if you get enough iron in your diet, celiac disease or intestinal surgery such as gastric bypass may limit the amount of iron your body can absorb. Endometriosis. If a woman has endometriosis, she may have heavy blood loss that she cannot see because it is hidden in the abdomen or pelvic area. Risk factors. Anemia is a common condition and can occur in both men and women of any age and from any ethnic group. Some people may be at great risk of iron deficiency anemia than others, including women of childbearing age, pregnant women, people with poor diets, people who donate blood frequently, infants and children, especially those born prematurely or experiencing a growth spurt, vegetarians who don't replace meat with another iron rich food. If you are at risk of iron deficiency anemia, talk to your doctor to determine if blood testing or dietary changes could benefit you. How it's diagnosed. A doctor can diagnose anemia with blood tests. These include complete blood cell test. A complete blood count is usually the first test a doctor will use. A complete blood count measures the amount of all components in the blood, including red blood cells, white blood cells, hemoglobin, hematocrit, platelets. The complete blood count provides information about your blood that is helpful in diagnosing the iron deficiency anemia. It includes the hematocrit level, which is the percentage of blood volume that is made up of RBCs, the hemoglobin level, the size of your RBCs. A normal hematocrit range is 34.9 to 44.5% for an adult woman, and it is 38.8 to 50% for adult men. The normal hemoglobin range is 12 to 15.5 grams per deciliter for an adult woman and 13.5 to 17 grams per deciliter adult man. In iron deficiency anemia, the hematocrit and hemoglobin levels are low. Also, RBCs are usually smaller in size than the normal. A complete blood count test is often performed as part of a routine physical examination. It's a good indicator of a person's overall health. It may also be performed routinely before a surgery. This test is useful to diagnose this type of anemia because most people who have an iron deficiency don't realize it. Other tests. Anemias can usually be confirmed with a CBC count. Your doctor might order additional blood tests to determine how severe your anemia is and help determine the treatments. They may also examine your blood using a microscope. The blood test will provide information including the iron level in your blood, your RBC size and color. RBCs will be pale if they are deficient in iron. Your ferritin levels, your total iron binding capacity, Ferritin is a protein that helps with iron storage in your body. Low levels of ferritin indicates low iron storage. A total iron binding capacity test is used to determine the amount transferrin that's carrying iron. Transferrin is a protein that transports iron. Test for the internal bleeding. If your doctor is concerned that internal bleeding is causing your anemia, additional tests may be needed. One test you may have is fecal occult test to look for blood in your feces. Blood in your feces may indicate bleeding in your intestine. Your doctor may also suggest an endoscopy in which they use a small camera on a flexible tube to view the linings of your gastrointestinal tract. An upper endoscopy allows a doctor to examine the lining of the esophagus, stomach, and the upper part of the small intestine. And a colonoscopy or a lower endoscopy allows a doctor to examine the lining of the colon, which is the lower part of the large intestine. These tests will help in identifying the source of your gastrointestinal bleeding. Iron deficiency anemia in women. Pregnancy, significant menstrual bleeding, and uterine fibroids are also the reasons why women are more likely to experience iron deficiency anemia. Heavy menstrual bleeding occurs when a woman bleeds more or longer than women typically bleed during menstruation. According to the Center for Disease Control and Prevention, typical menstrual bleeding lasts for 4 to 5 days and the amount of blood loss ranges from 2 to 3 tablespoons. Women with excess menstrual bleeding typically bleed for more than 7 days and lose twice as much blood as normal. According to the National Heart, Lung and Blood Institute, an estimated 20% of women of childbearing age have iron deficiency anemia. Pregnant women are even more likely to have iron deficiency anemia because they require great amounts of blood to support their growing babies. A pelvic ultrasonography can help a doctor look for the source of excess bleeding during a woman's periods such as fibroids. Like iron deficiency anemia, uterine fibroids often don't cause symptoms and they occur when muscular tumors grow in the uterus. While they are not usually cancerous, they can cause heavy menstrual bleeding that can lead to iron deficiency anemia. Health complications of iron deficiency anemia. Most cases of iron deficiency anemia are mild and don't cause complications. The conditions can usually be corrected easily. However, if anemia or iron deficiency is left untreated, it can lead to other health problems. These include rapid or irregular heartbeat. When you are anemic, your heart has to pump more blood to make up for the low amount of oxygen. This can lead to irregular heartbeat. In severe cases, it can lead to heart failure or an enlarged heart. Pregnancy complications. In severe cases of iron deficiency, a child may be born prematurely or with a low birth weight. Most pregnant women take iron supplements as part of their prenatal care to prevent this from happening. Delayed growth in infants and children. Infants and children who are severely deficient in iron may experience delayed growth and development. May also be more prone to infections. Treatment options. Iron supplements. Iron tablets can help restore the iron levels in your body. If possible, you should take iron tablets on an empty stomach, which helps the body absorb them better. If at all they upset your stomach, you can take them with the meals. You may need to take the supplements for several months. Iron supplements may cause constipation or black stools. Diets that include the following foods can help treat or prevent iron deficiency: red meat, dark green, leafy vegetables, dried fruits, nuts, iron fortified cereals. Additionally, vitamin C helps your body absorb iron. If you are taking iron tablets, a doctor might suggest taking the tablets along with a source of vitamin C, such as a glass of orange juice or citrus fruit. Now, treating the underlying cause of the bleeding. Iron supplements won't help if excess bleeding causes this deficiency. A doctor might prescribe birth control pills to women who have heavy periods. This can reduce the amount of menstrual bleeding each month. In the most severe cases, a blood transfusion can replace iron and blood loss quickly. Prevention. When caused by an inadequate iron intake, iron deficiency anemia can be prevented by eating a diet which is rich in iron rich foods and vitamin C. Mothers should make sure to feed their babies breast milk or iron fortified infant formula foods. Foods that are high in iron include meats such as lamb, pork, chicken, and beef, beans, pumpkins, leafy greens such as spinach, raisins, and other dried fruits. Seafood such as clams, sardines, shrimps, oysters, iron fortified dry and instant cereals. Now, foods that are rich in vitamin C include fruits such as oranges, grapefruits, strawberries, kiwis, guavas, papayas, pineapples, melons, and mango. Broccoli, red and green bell peppers, Brussels sprouts, cauliflower, tomatoes, and leafy greens. Thank you for the patient listening. Subscribe, like, share. Dr. Ravichandra Official.